Next, we move to varicella. Varicella is a DNA virus. It initially causes what we know as chickenpox. It results in lifelong latency. It travels to the dorsal root ganglion in the spinal column, and then can come out years and years later in the form of herpes zoster. Here's our case, and it is a classic case. Notice the details. A 29-year-old woman, gravid 2 para 1, is at 34 weeks. She's preterm. She complains of uterine contractions every 5 minutes. Over the last few days, she has developed diffuse pruritic vesicles. When you think of vesicles, and she has a fever and malaise, you think of a herpetic type of infection. Vesicles, now they're not genital vesicles. These are on her chest and breasts. This is consistent with varicella. How is varicella transmitted? Is it by cat feces? No. It is by respiratory droplets. And it's estimated that probably 3 per 1,000 pregnancies may be exposed to that. Is the residual effect a lifelong latency or a lifelong immunity? And it's important to remember this is lifelong latency. Once you've got it and the virus is in your dorsal root ganglion, it's going to be there for the rest of your life. The highest risk of fetal infection is 5 days antepartum to 2 days postpartum. There is something about labor and about the time of labor when the risk of fetal infection is the highest. And in the case that we had, she was 34 weeks. She was having contractions. We'd like to keep this fetus from delivering. The maternal complication that could lead to maternal death is pneumonia. And if you get varicella pneumonia and you're pregnant, that's not a good thing. How can we prevent varicella infections? If she has had no antibodies and she is susceptible, varicella zoster immune globulin can be given and prevent infection if it's given within 96 hours of exposure. Fairly pricey, about $700, but that is a low amount when you consider what it can prevent. Now, if she's not pregnant, you can give a immunization, and the trade name for this is Varivax. It is, however, not advised during pregnancy because it is an attenuated live virus. Anytime you have a live virus, you'd like to avoid that during pregnancy. If there is varicella pneumonia, management is IV acyclovir. And acyclovir has a long history of safety during pregnancy. What happens with varicella is very similar to what happens in herpes. With the infection, where does it go? From herpes and varicella, it goes to the dorsal root ganglion, and there it sets up housekeeping. And then at intervals, or if there is appropriate stimulation, out it comes, and it will typically appear in the same site where it was obtained in the first place. So, lifelong latency. Here you have the vesicles of herpes zoster. Here we have some more of the, not of zoster, of varicella. This child has a significant case, and yet if it occurs during childhood, it's usually not a big problem. You can see in the mouth even with this child. Here we have skin vesicles which have now blistered. This is a woman who actually died from varicella pneumonia. When you look at this chest x-ray, atypical pneumonia, very poor, distinct heart border, and you can see it's all over the place. Not a good thing to have. Here's another, diffuse pneumonia. It can come back in the form of varicella, and here's a child, as zoster, herpes zoster, and you can see here. And notice the dermatome distribution, very common with herpes zoster. This is an advertisement for Varivax, a varicella live vaccine. Women contemplating pregnancy should know their risk to both mother and fetus. Pregnant women with chickenpox may experience pneumonia, we talked about that, premature labor or premature delivery. Fetal risks include birth defects of the limbs, skin, eyes, and brain. And this is particularly if it occurs early in the pregnancy. Chickenpox can be severe or even fatal in newborns of mothers who acquire the infection from 5 days before to 2 days after delivery. So it's in that period of time around labor and delivery when the risk is the highest of transmission to the newborn. Varivax. Zigzag skin lesions is skin scarring, which can happen if you have the infection early in the pregnancy. If you see on the exam zigzag skin lesions, think congenital varicella, early infection. Zigzag skin lesions, microphthalmia, this is small eyes, extremity hypoplasia. Now, when do the extremities develop? Extremities usually develop around 8 to 9 weeks. If you have an early infection, you can have reduction of the limb buds and extremity hypoplasia. What percentage of women who are of reproductive age are seropositive for varicella? 90%. So this is a small pool of women who would be susceptible. Most women already have the antibodies. And that is the end of the varicella section.